For the last few years, they've been saying meth was a second epidemic going on in America. Well, meth is now killing people at a much faster pace now than ever before. This came out in the New York Times. A new drug scourge. Deaths involving meth are rising fast. Today's meth is far more potent than earlier versions, but because it isn't an opioid, many federal addiction treatment funds can't be used to fight it. So they are not fighting meth like they do opioids. Okay, so I'm just going to go down. All right. Deaths associated with meth use are climbing here in Oklahoma and in many other states, an alarming trend for the nation battered by the opioid plague, and one that public health officials are struggling to fully explain. So, you got more than people dying just from one drug. Actually, people are dying from several different drugs out here. You have the opioids, and a lot of people are dying from fentanyl. And now you have meth, and those death rates are rising out here. So, ladies and gentlemen, the meth problem has sneaked up on state and national leaders. In Oklahoma, meth and related drugs, including prescription stimulants, now play a role in more deaths than all opioids combined, including painkillers like heroin and fentanyl, according to the Center for Disease Control and Prevention. The spending package that lawmakers agreed on this week includes legislation from Senator um, Jeanne Shaheen, Democrat of New Hampshire, and Rob Portman, Republican of Ohio, that would allow states to address the resurgence of meth and cocaine by using some of the billions of dollars that Congress had appropriated to combat opioid addiction. Now, isn't it amazing? I want y'all to think about this. When we bring up reparations, there is no money. There is no money, right? But they have all the money on this planet to fight opioids. It's always a billion over here, another billion, and they're going to throw another billion. And they have spent well over $1 trillion on fighting an addiction that they cannot beat. I want you to think about that. They've been fighting this now for several years, and they cannot beat this addiction. They're not even making headway. Now it went and it keeps morphing into other things. So it was heroin, then it went to opioids, and then it went to a combination of opioids and heroin, and then fentanyl got thrown in the mix, and we heard of carfentanil, and now meth is wiping them out. But nevertheless, the addiction never stops. The drugs may kind of switch over, but the addiction itself never, ever stopped. And they've already spent well over $1 trillion. I want you to think about that. But when we bring up reparations, oh, well, we can't There's no money. It's not enough money. They're lying. This country got plenty of money for everything else. Plenty. Meth use first ballooned in the United States from the 1990s into the early 2000s, when it was often made in small home labs. Right. Do you remember all those homes exploding around the country? You would hear about a meth lab that they were using at a house and it would explode. We have a couple of them around here. You'll drive down the street and all of a sudden you'll see this big gap in between the houses. That was one of the houses that exploded. And there's like several streets you can go down and you'll see that. You'll be driving along, you'll see all the houses on both sides, and then all of a sudden here's this big gap. Mm-mm-mm. Okay, so pseudoephedrine, the main ingredient in many drugstore cold medicines. Is that why they got the cold medicine locked up behind the cashiers now? I know they do around here. I guess it's for all that meth use, huh? Didn't think about that. But today's meth, largely imported from Mexico, is far more potent. And they said it's a better quality than what they made in these meth labs here in America. That's why a lot of people are buying it from Mexico, because it's a better quality and it's cheap. It's way different from the meth people were using 20 years ago, said Dr. Jason Beeman, the chairman of psychiatry and behavioral science at the Center for Health Sciences at Oklahoma State University. It's like they were drinking Mountain Dew and now they're injecting Red Bull. Wow. Nationally, since last year, meth has turned up in more deaths than opioid painkillers like oxycodone and hydrocodone. In 14 of the 35 states that report overdose deaths to the federal government on a monthly basis, meth is also involved in more deaths than fentanyl, by far the most potent opioid. Provisional data from the CDC shows there were about 13,000 deaths involving meth nationwide in 2018, more than twice as many as in 2015. That is still far fewer than opioid deaths overall, which passed 47,000, but the pace is accelerating while opioid fatalities have flattened. Now, ladies and gentlemen, they don't know that for certain. Let me just tell you something. Only 22 states in this country reports their drug deaths to the CDC. All of the other states don't report any numbers. So anything they give you in these articles are not going to be accurate, and it's going to be an undercount. You know, it goes back to what I said before. They play a lot of psychological warfare. They want you to believe, oh, well, this is going down. Yeah, it's going down based on 22 states. You did not go to the other states to get their numbers. So it's all a head game. Everything they do in this country is just one big head game. But the pace is accelerating. Okay, so I read that. The most recent federal data, for example, estimates that from May 2018 to May 2019, there were 24.6% more deaths involving meth and other drugs in its class than in the previous year, compared with 9.4% more deaths involving fentanyl and other synthetic opioids. Deaths involving meth has been concentrated in the western United States, but are moving eastward, even to regions that meth barely touched in the past, like New England. This is the one thing that keeps me awake at night, said Dr. Brett Gervor, Assistant Secretary for Health at the Health and Human Services Department, at a conference on stimulant abuse on Monday. Within a few short months, you can model it any way you want. Methamphetamines will be secondary to fentanyl nationwide, associated with drug overdose deaths. Unlike with opioids, there is no way to reverse the effects of meth overdose. So they can't use Narcan on meth overdose like they can for opioids. It doesn't work. You can't reverse it. So if somebody is dying from meth, they can't show up with the Narcan and bring them back. So now that turns into a whole different problem. Just as there is no medication approved to treat meth addiction and the craving it creates. For now, treatment for meth addiction consists largely of behavior therapy. So they can't even use methadone, y'all. They can't even use that to treat somebody that's strung out on meth. With a much more moderate effect size compared with medication. For many here in Oklahoma, what treatments do exist are out of reach. Most poor adults in the state do not qualify for Medicaid coverage that would help those with meth addiction gain access to treatment. Because the state has chosen not to expand the program under the Affordable Care Act, which is Obamacare, and while Oklahoma has won a windfall of money, $355 million from lawsuits against opioid manufacturers. Much of it is especially for fighting opioid addiction. So right now, y'all, if they got a meth problem, there is absolutely nothing they can do other than behavioral therapy for them. That's it. They can't do nothing else for them. And meth addiction cannot be reversed. Can't be reversed. So once these people are hooked on meth and they die, that's it. That's really it for them. There's no chance of bringing them back. But you see how they literally their aging accelerates when they're on meth. It is almost like they go from someone young to someone elderly over a short period of time. So, I mean that in itself is a huge problem. Okay. So they said, we know there is funding coming in for opioid problems, said Mimi Taresh, the chief officer of Women in Recovery, an alternative sentencing program in Tulsa. Mm-hmm. So instead of going to jail, we'll give you this alternative treatment program. You can go there. That way you don't have to go to jail. Wow. But what I see and what our community continues to see is really a lot of addiction to methamphetamines. So this one, ladies and gentlemen, they are helpless. They are helpless. They can't treat this. And as more people go on this and die, there you got another big part of the population that's going to be gone from meth. And they don't really give you the true numbers, even on opioids. So I doubt if they'll give you the real true numbers on meth. That's how it is, And then they try to mask and disguise everything so that you don't believe it's that bad, but it's actually a very devastating thing going on. So getting real numbers on how many people die, good luck. Good luck, because America is good at masking and disguising numbers. Look, they told us we're 13% of the population since 1860. and and they expect us to believe this when we know there's no possibility for that to be true. And they have told us all this time that the Latinos was the next biggest in the country, and that's not true. Ladies and gentlemen, I found an article that went back to 2013 that talked about the Hispanics' birth rates had dropped dramatically, and it was from 2013. 2013. They said the younger generation, they want careers, they want to earn more money than their parents, and they want smaller families. But what have they told us all this time? Oh, the Latinos, oh, they're past black people, they are exploding. And that's not true. It's not true. This younger generation, they don't want all them damn babies. They don't want it. They want a better lifestyle than their parents had. But this article was 2013 talking about the decline in Hispanic births. So America is good at playing up the numbers. And just think about this too, y'all. They'll tell you these numbers without showing you any data or evidence. They'll just get on TV, on Main Street. Oh, well, black people are 13% of the population. You notice they never show us any data. They just keep telling us this over and over, and they never show you any real true data of the black count in America. That's why they are going above and beyond to count us in 2020, because they've never done that before. So when they say 13% of the population, they're not really basing that on any good data. They've never done a good count. And remember, they never counted the people in prison. But for the first time in 2020, they're going to count those folks. Y'all tell me what you think about these meth deaths that's surging in the country. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.